When you think of the drug LSD, you might think bad for you, dangerous, illegal. But studies show benefits in treating mental disorders. In early March, the Food and Drug Administration (FDA) granted breakthrough therapy designation to the company Mind Medicine for its drug derived from LSD to treat generalized anxiety disorder. The drug is called MM120 and its chemical name is lysergide D-tartrate. This is a salt form of lysergide, a semi-synthetic hallucinogen commonly known as LSD. Breakthrough therapy designation for MM120 was granted after the recent phase 2 trial showed that one dose of MM120 had a significant reduction in anxiety symptoms. This study also showed that the improvement in anxiety symptoms was as quick as from the second day of treatment and also lasted for as long as 12 weeks after a single dose, just one dose. Impressive, phenomenal actually, when you consider that medications like SSRIs take 4 to 6 weeks to work. The study also showed that MM120 was generally well tolerated and mostly presented with the expected side effects of such a drug. Also, compared with the experiences with forms of LSD purchased illegally on the streets, the study's grade of MM120 did not appear to induce bad trips. Now, breakthrough therapy designation by the FDA is a process designed to speed up the development of new medications for serious conditions, especially when there is evidence that the medication shows a significant advantage over existing treatments. In this case, they fast-track the process to make the medication available to the public quicker. This study is also fascinating because all the people involved had just MM120. The researchers stopped their previous anti-anxiety and antidepressant medications. They also did not have psychotherapy during the study. This means that MM120 was responsible for treating the anxiety symptoms. And just a single dose, truly fascinating. Two other psychedelics that have received breakthrough therapy designation are MDMA for PTSD and psilocybin for depression. So, what is LSD? LSD stands for lysergic acid diethylamide. It is a synthetic drug that has been abused since the 1960s because of its hallucinogenic properties. LSD causes dissociation and can alter the user's sense of self and time. Anxiety disorders are the most common mental illnesses in the US and affect over 40 million adults. That's about 1 in 5 people. Unfortunately, less than half of this population receive treatment. Generalized anxiety disorder causes anxiety about events or activities on most days for at least 6 months. It can lead to restlessness, feeling on edge, fatigue, difficulty concentrating, irritability, muscle tension, and sleep problems. So back to MM120. How does this medication work? Scientists don't know exactly how, but there are a few theories. It is thought that LSD breaks down persistent negative thought processes and helps with neuroplasticity. This is the ability of the brain to form new connections. These new networks in the brain enable you to change thought patterns and how you process things. As a result, you can get new perspectives and reduce rigid negative thinking patterns. People who have anxiety and depression tend to have more negative thoughts that keep them anxious and depressed. Psychedelics are thought to break down or reprogram these negative thoughts. It's like cleaning a dry erase board and writing brand new content. Current medications we use to treat anxiety work by altering brain chemicals like serotonin, norepinephrine, and dopamine. Psychedelics, on the other hand, take this a step further and work by rewiring your brain. These drugs also work much faster compared to the current medications we use for anxiety. Breakthrough designation therapies like MM120 progress through pre-market development faster than conventional medicines. Considering the excitement with this drug, I'm sure you're wondering when it will be available to the public. LSD is difficult to manufacture with high purity and tends to degrade quickly in the presence of light and water. One of the challenges for mind medicine will be manufacturing a highly pure and stable version. Considering how far they've come, I'm sure they have this covered. There are three main phases for new medication clinical trials: phase 1, 2, and 3. Mind Medicine just completed phase 2B of its clinical trial and plans to move to the final phase, phase 3, in the second half of 2024. This means we're getting closer to having this medication made public for the treatment of generalized anxiety disorder. Subscribe and stay tuned. I'll keep you posted.